We make a very strong commitment to train the next generation.
MD Anderson is also the #1 place to train if you want to train in oncology.
You have the best supervising physicians, the best attending physicians, a multidisciplinary approach that allows you to learn how to treat a cancer patient from multiple different angles.
Choosing MD Anderson for graduate study, it was an easy choice. It is one of the premier cancer centers in the world. I think what's really impressive about such a large system is that it feels so small as far as the interactions between different departments.
Trainees will actually work with world-class clinicians, world-class scientists, world-class publishers, people who are very, very well known in their field.
The residents are engaged one-on-one with faculty. I think it's to involve the trainee at every step of the care process, challenging them to make the decisions on their own.
You are coordinating care between services, you are devising treatment plans, you are their doctor. It's a very good experience as far as autonomy.
MD Anderson celebrates all walks of life. It's just important that we can connect with the community that we serve. We can connect with our patients.
Oftentimes we get the most challenging patients that have failed standard of care in their respective countries or cities locally within the United States.
I think that we really take it to a whole nother level here at MD Anderson. It's amazing. You really feel that each member of the team is invested in caring for that patient and making sure that the team as a whole agrees upon the plan of care. Most of us have the opportunity to participate in research while we're here as well, which is phenomenal.
MD Anderson has one of the largest clinical trial programs in the nation. This allows our oncologists to have direct experience with new cancer treatments years before they're FDA approved.
We're not only training physicians, we're training nurses, we're training PAs, we're training the next generation to fight the cancer that we're trying to fight now.
When people finish and leave here, we want them to move the ball forward, so to speak. We want them to take what we're currently doing and challenge it and develop new things.
These are 3 different articles that I found. The first one is kind of a meta-analysis where they looked at...
One of the biggest strengths from training at MD Anderson is that you've networked with so many people, not only across the United States, but also across the world.
You have people who are leaders in clinical work, leaders in translational research, leaders in bench research, and those connections open new connections.
MD Anderson is vast, not only within Houston, but we do have satellite centers, not only nationally, but internationally.
In a affiliated Banner type or Cooper or Baptist type facility, or even in a global network, has enormous value for our graduates. So they feel they can move out and still have closer ties and maintain those relationships that they built during training.
Having cancer networks associated with MD Anderson Cancer Center in Houston is amazing for both the patients and for the people who work there. I'm working with very dedicated, top-notch physicians and other providers to take care of patients.
You would find, graduating from MD Anderson, these organizations look for you. I had to do very little in the way of putting my name out there.
I do think it's possible to have a reasonable work-life balance here, and I think that's something that actually the institution makes efforts to encourage.
We want people to be healthy physically, we want people to be healthy mentally, and so it's our job to provide those opportunities and to help trainees understand it's not work, work, work.
Outside of the program, we all have very active social lives. Whether you are single or you have a family, I feel like there's a lot to do. This is one of the best decisions that I've made in my life.
It's been an incredible opportunity to see the way that people work together to improve the lives of all their patients.
Training and education are such an important part of our mission because we are thinking about tomorrow and the next generation of cancer leaders. Our trainees will be part of the team that helps us to end cancer. We want to create a talent pipeline that really fuels our clinics and our research labs.